AB blood group mismatched liver transplantation has been a complete game changer among children. When small children need liver transplantation, it's usually one of their parents who turns out to be a partial liver donor. Now, there are instances where the blood group of the child may not match up with either of the parents. But now, with ABO incompatible liver transplantation having been practiced for the last 11 years at the Medanta Liver Transplant Institute, any child with any blood group can have a successful liver transplantation by one of his parents donating a different blood group liver.
When we talk about liver transplantation, you'll be surprised we never say HLA matching like we do in kidney. But in liver transplant, we look for blood group matching. So A should get A or O, B should get B or O, AB can get any liver donor, and O has to get an O donor. But sometimes you are stuck against the wall where when you're doing a living related transplant and you do not have any donor who's matching, that is when we end up doing an ABO incompatible or a mismatch. So what is very important in this is the medical management part. Surgery may be the same, but medically you will need first to get those antibodies out of your body, out of the patient's body. So you might do a plasmapheresis, immune adsorption, and sometimes in older children we use a medicine so that new antibodies are not formed and so that the new liver is not rejected by the body. So that is when, otherwise you'll reject the other blood group. So that is what we need to look into it. It's a little more expertise is needed by the team to tackle ABO liver transplants, but touch wood, with the advances in the medical management, we see equally good results now.
We first did it in a 2-year-old child 11 years ago, and now she's a healthy 13-year-old enjoying normal life. In fact, we've realized that children less than 2 years need no changes in the protocol, whereas those from 2 to 18 years will need some extra treatment before their transplantation so that they can have a successful ABO mismatched transplant. And now, among several such cases, we have a 95% success rate.